What should you do to avoid getting infected with acute respiratory viral infections or the flu? What should you do if you are already infected and have symptoms? How do you properly relieve the symptoms? How can you save your life during a pandemic? That's exactly what we'll be talking about with you today. I'm Dr. Vasyl Chaika. Let's get started. According to the classical approach, there is some kind of pathogen. It is studied, identified, and we are constantly told about it on television, in the media, or by certain specialists wearing a medical coat just like I am now, that this is a terrible disease and you can get infected with it. And how can you get infected with it? Through airborne droplets. For example, right now as I speak, saliva particles can travel up to 2.5 meters, and the cameraman filming me should already be getting infected by me if, for instance, I have any symptoms. But for some reason that doesn't happen. And here's another very interesting question from a doctor who is on duty at the clinic. For example, when I worked as a pediatrician in a public hospital, I could see up to 50 sick children a day. And for some reason, I didn't develop any symptoms for weeks or even months, even though I was in daily contact with what we call infections. Of course, the explanation here is very simple. Doctors, you have a strong immune system. There is actually no such thing as immunity. As an organ, so what is actually happening in my body? Why do I stay healthy and have no symptoms? And why don't I get infected? Let's break this down in more detail, but from the perspective of a comprehensive approach to our body, where we have a brain that controls our body, and our brain has channels for perceiving information. These are sight, hearing, smell, touch, tactile, and emotional sensations. So the changes that we call acute respiratory viral infections, or for example, the trendy new diseases that are being used to scare us now, these are reflex reactions. Of course, it may sound strange to you. Where is the evidence? You need to understand a very simple thing. For our brain, it doesn't matter whether this situation is actually happening or if you're just imagining it. Let's do an experiment together right now. Please sit comfortably and imagine a yellow lemon. Now look at the screen where you see a juicy, juicy yellow lemon. Pick up a knife and carefully slice this little lemon. Take the juiciest slice of lemon, put it in your mouth, and your mouth fills with lemon juice. And oh, miracle! You start to salivate. Some people get a tingling sensation in their teeth, others have some other reaction. But what's the point here? You were just imagining the lemon, meaning it wasn't actually real at the moment you were thinking about it. But a very specific reaction was triggered in your body. When certain information enters through your channels of perception, sight, hearing, smell, touch, tactile, and emotional sensations, even if it's not real but virtual, a certain reaction will be triggered in you. If we're talking about the respiratory tract, these are also very specific conditions. So let's move on to these conditions. What triggers this reaction? First, if we're talking about the nose, its function is to detect smells. So when you don't sense the so-called danger, you will trigger the reflex of the nasal mucous membrane. If you get scared, oh, that's the kind of reaction that occurs. For example, a woman sees a spider, and she reacts like this, oh. Or for instance, a small child gets scared of something. Or a loud sound, for example, one above 65 decibel. Oh, that's how little children react too. The mucous membrane of the larynx will be triggered. If you, for example, see your rival, or say a teacher, or maybe a colleague you dislike, someone you really hate and already want to confront. Virtually, of course, this angry bronchial shell is activated in you. That is, nothing is actually happening, you're not fighting with anyone, but in reality, these situations are just playing out in your head. Some people might say you're imagining things, others might call it psychosomatics. But it's a reflex reaction. As soon as such an event occurs, a very specific process is triggered in your body. This process happens in two stages. So the first stage of this process, this reflex, is that your body starts to change, enhancing the physical parameters of your body. If we talk about the nose, the throat, the mucous membrane of the bronchi, then as soon as the reflex is triggered, the flat epithelium there begins to thin out in order to widen your airways and help you better detect smells. So that your voice becomes deeper, making it easier for you. Thank you. To drive away a virtual danger so that more air passes through the biological tube into your lungs so that you have the strength and ability to drive away the virtual enemy or fight with them. And almost everyone overlooks this active phase of the reflex. As soon as you have driven away the enemy, or as soon as everything in your life has normalized, or as soon as the danger, real or virtual, has disappeared, now the body begins to restore itself. And it restores itself according to the following rule. Recovery begins with the fact that fluid, water, is pumped into the tissue, swelling occurs there, and you start to experience the first symptoms. In the nose, this means nasal congestion. If it's the throat, you develop hoarseness. If it's the bronchi, a cough starts to appear. At the same time, the body creates the necessary conditions to restore as quickly as possible the volume of epithelium that was reduced during the active phase. So what happens? Body temperature rises and it can go up to 39.5 degrees Celsius and even higher. And this is normal because only at such a temperature are specific epithelial cells formed. You also experience lethargy, weakness, and a severe headache. Why? Because this is also due to swelling of the control center for these organs in the brain. Understanding that the first phase of the recovery process is swelling, you will know what not to do in order not to harm yourself. And by knowing this recommendation, which I will talk about later, you could even save your own life. So, what happens next? When the healing process is complete, the water begins to be removed from the body through a biological method. And this manifests itself in the following way. Suddenly, in the midst of what you might interpret as a worsening of your condition, you start to feel very unwell, you might feel dizzy, or you could even lose consciousness for a few seconds. This is normal. And after you come to, the following happen. You sweat heavily. Why? Because your blood sugar drops? Sugar. The first aid here is to give the person sugar to quickly restore this phase and stop it. And then, when this state passes, which only lasts a few seconds, you start urinating very intensely. You drink little water, but you start urinating intensely. And by understanding this process, you should draw the first conclusion. No one attacked you, but rather a very specific protective reaction was triggered. When you understand this, you move on to the next stage. This is helping yourself on a physical level. And the first step in helping yourself is physical calm, realizing that no one attacked you. This is a reflexive situation. And when you experience swelling, when your body temperature rises, when you feel weakness, in other words, what is called a deterioration of your condition, this is not the beginning of the end. It is the beginning of your body's recovery after the reflex. It's very important to understand this, and many people haven't grasped it. And for them, as one doctor said, it was their last autumn. So to make sure this doesn't happen in your life, and so you can still have many autumns, winters, and springs ahead, you need to understand how the body works. And you can easily check this yourself as well. What's important? The important thing is that as soon as these symptoms appear, first, the brain sends a signal to the kidney, and the kidney retains water, pumping it to the area where inflammation occurs. That's why the first and main rule for helping yourself, as soon as you notice symptoms, is to reduce your water intake. Unfortunately, it is mistakenly recommended by everyone to drink more water to supposedly reduce some minimal intoxication, but in reality, physiologically, you actually need to reduce your water intake. And you will notice this: as soon as the first symptoms appear, your kidney reduces the excretion of water. So look, please observe yourself. That's why you should consume between 300 and 500 milliliters of fluids per day. That's the maximum you need. This is for adults. If it's a child, you give the child exactly as much to drink as they ask for. Of course, many people might say, oh, there will be dehydration and so on, but all of that is just stories and myths, and no dehydration has ever occurred in this situation. And it won't happen if you do everything biologically correctly. The next point is, when you restrict water, you need to know that you should rest more and sleep more. However, as soon as you fall asleep, the autonomic nervous system is activated and discomfort will increase. That is, there will be physical discomfort as well. What should you do in this case? We need to remove the excess water. How do we do that? So first, for adults, it's drinking coffee. 2 or 3 cups a day. You can have a little more. You need to remember that in the evening, your temperature will drop and swelling will increase. Why? Because the autonomic nervous system becomes more active. So reduce your water intake, add coffee, and you can also add various types of diuretic teas. It doesn't matter what they're called, herbal, they don't really matter. But for example, you can use rosehip, hawthorn, field horsetail. It doesn't matter which one you use. But you need to remember that the total amount of liquid should not exceed 500 milliliters per day, including the coffee and diuretics you consume. Another important point is that you should not take chemical diuretics because they stimulate the kidneys, and this can be dangerous. Additionally, what else should you do, for example, if you have a severe headache, is to use cold or ice. Apply it to your head. This reduces swelling and will also improve how you feel. Additionally, if we talk, for example, about coughing, when it occurs, when a cough appears, it's not that an illness has struck, but rather it's a repair process. In other words, a cough is a protective mechanism that allows the bronchial and pulmonary systems to expel phlegm. Phlegm is the waste material from the repair process that is already present. For this, for example, what can we do to better help the cough to be effective? Is to breathe cool, humid air. In the room or space where you are, the temperature should be 17 to 19 degrees Celsius. It's better for you to dress warmly but breathe humid, cool air. The humidity should be 60 to 65%. How can you achieve this? Either use a humidifier, or if you have radiators or heaters, you can place damp towels on them. Or you can open a window and also lower the temperature in the room. Go out onto the balcony or outside and spend a little time there. That's how you do it. What if these are small children? Can you take them outside? Yes, you can. Can you open the window for them? You can do that too. Additionally, to help improve the clearance of mucus, you can perform vibration therapy. There are a few ways to do this. First, when you place your hand on the chest, you use tapping like this. 1, 2, 1, 2. And move along the chest. This may cause coughing. The duration of this procedure is 5, at most 7 minutes. You can also use devices, for example, something like a vibromassager, of course. You can also turn it on at the lowest speed, and like this, you see how it works. The same procedure is performed for a maximum of 5 to 7 minutes. This will also help with clearing the cough. What else, for example, can be done for small children? Give them a straw and have them blow into water, making bubbles. This creates what's called a positive exhalation and will also help improve the removal of mucus. At the same time, of course, the cough will become more intense. Another important point is that as your body heals, you will sweat heavily at night. This is normal, so you need to make sure to wear dry underwear. For example, if you sweat and then get chilled, you should know that the cough will always get worse. Additionally, when you have a cough, you can use a herbal blend that helps the phlegm come out more easily. So what do we use for this blend? It includes elderflower, coltsfoot flowers, and an herb called Succession, string. Take 1 tablespoon of each herb, put them all into one container and pour 700 milliliters of boiling water over them. Let it steep for 2 hours, then strain it and you can drink it. You should take 150 milliliters 3 times a day, 10 minutes before meals, and the minimum course is 14 days. But what about children? Children can also take it. If the child is between 5 and 12 years old, you can give them 50 milliliters 3 times a day for up to 14 days. You need to remember one very important thing. A proper cough has its own stages. At first it is dry and infrequent. Then it becomes dry and frequent, then wet and frequent, then wet, frequent and deep, then deep and infrequent, and only after that does it disappear. So remember, don't fight the cough, but give it a chance. Allow this protective reflex in the body to do its job. But what should you do if your body temperature rises? You should remember that body temperature is also a protective reflex, or in fact a protective condition in our body, designed to initiate the healing process. And since this is a squamous epithelium, the temperature will be 39.5 degrees Celsius and above. It's not, oh, the temperature is high, that's bad, but rather these are normal conditions. And of course, we can make this process easier. This process, how? By wiping down. For example, with plain water or water with vinegar. What does this do? It's the process of evaporation, and the faster evaporation happens, the faster the temperature drops. What's important? Not to wrap children up, because children do not have a mature sweating system, so they can't cool down like adults. If you overheat children, it will only make their condition worse. So it's better to uncover them, just cover their back. It's not a problem if their limbs are exposed. Thank you. Cold limbs are not a big deal. Let me repeat once more. Your children will not get sick and their condition will not get worse. But this way, you allow the child to release heat. What else can we do additionally when there's a fever? Again, we can use a bath for this. Many people will say, how can that be? Isn't it forbidden to use a bath? Yes, the bath should not be hot. If you don't want to use a bath, you can simply use wiping instead. And that will be enough. Of course, if this doesn't help, you can additionally use chemical remedies, giving them in the appropriate doses. But let me repeat once again, you need to remember that fever is not a threat. Because look at what this leads to. If you treat a cough as a threat that's attacking you, a fever, oh no, something must be done, or some other symptom like a runny nose, oh no, something must be done. Remember the lemon? Right away, a new defense mechanism will kick in, and you'll end up treating your acute respiratory infection not for 2 to 3 days, but for a week or even longer. So remember, there's a saying, right? If you treat it, it lasts a week. If you don't, it goes away in 7 days. So to do this correctly, use these recommendations and stay healthy.